It's my job to show you how the ISQ scale is used in daily practice. I use it to improve my success. I use it to reduce the treatment time for my patients. I use it to avoid premature loading. I use it to improve predictability with high-risk patients. And I use it to determine when to proceed with the definitive restoration. This entire list is used to improve the success rate overall, long-term wise, for our patients. If you in the audience really want to be critical as far as improving the outcomes for your patient, then you have to use some objective way to determine when that implant has achieved biologic stability. And if you've ever attended any of my training courses or my advanced clinical training program at UCLA, you know that every single implant that I placed over the last 15 years have been measured with ISQ. And at this point, the reason why I take these measurements is because we are seeing more demands from our patient as far as earlier and earlier treatment times. We're also seeing the pressure that are placed on us as clinicians from the implant companies, because they're the ones that are sitting out there right now telling our patients that they can get their tooth or their bridge sooner. And we're also being pressured by our competition, because many of the patients come in and say, well, Dr. So-and-so said that I can have my results right away. And all of a sudden, we're sitting there going, okay, we want to treat you as our patient, and we need to deliver what the doctor promised down the street. And so this is the reason why we need to take measurements, because if we are going to provide answers for our patients, we have to know how stable that implant is. We need to know whether that implant is solid enough, stable enough to provide immediate loading, or is it stable enough that we can perhaps go with earlier loading, or must that implant wait a specific period of time, or what we call traditional loading. We also have to be able to detect when an implant is having troubles, when the implant is not integrating in the proper rate, or at this point, if it has integrated at all.